Hello lovelies! So as I mentioned in my last video, I recently learned that I need to have heart surgery this year. I haven't talked about my heart condition very much on this channel because honestly it hasn't affected me a whole lot up until more recently. But I want to document this journey in order to help others going through something similar, not just the medical side of things, but the mental and emotional roller coaster that comes with having a chronic condition and facing medical surgery. I do have notes written out so I can stay on topic and try to get this said in a timely manner. So if I'm looking off screen, it's because I'm trying to follow my notes. So I think it's really important to talk about the psychological impact because living with a heart condition isn't just about the physical symptoms. It's about the anxiety, the fear, the way it changes how you see your own mortality and your future. So this won't just be a medical story. It's about the whole human experience of navigating this. At age 3, during a routine checkup, I think I had the flu or something, I'm not sure, but my mom took me to the doctor and we were in Japan because my dad was stationed there. Doctors discovered a heart murmur. So a heart murmur is just that your heartbeat sounds a little funny, and typically that means that there is a underlying heart condition in there. So they sent me to Hawaii for testing because at the time the hospital there in Japan did not have the necessary equipment in order to check out my heart fully and really understand what was going on. Apparently I screamed the whole flight because I did not want to be away from my mom, and my dad said that every woman on the plane tried to calm me down and it would not work. So the echocardiogram terrified me. An echocardiogram or an echo is where they basically do a ultrasound on your heart. So, there's the ultrasound gel that they use for regular ultrasound as well. And then the wand they use, I cannot remember what the actual term is. They use that to just take a picture basically inside of your body. So I, being 3, thought for sure that this technician was going to turn me into a peanut butter and jelly sandwich when they started putting the gel on, and I panicked and everything. But anyway, so they diagnosed me with a bicuspid heart valve instead of the typical 3 leaflets that most people have in their heart valve. I only had 2, so my heart had to work extra hard pumping blood. The doctor said that it wouldn't cause me any issues until I was a lot older. The only thing I really had to do, other than have imaging done fairly regularly, was taking an antibiotic every time I had dental work done. They don't do this anymore apparently, but the thinking back then was that when you get dental work done, it releases a bunch of germs and everything, which is still the case. But they were concerned that could cause an infection. So people with a heart condition, they would have them take an antibiotic about 30 minutes before the appointment. So that was the only time I really thought about my heart condition as a kid, was when I had dental work done and I had to take that giant pill. So I continued to have routine checkups. I'm not sure how often they were. I don't think they were every year. They were probably every couple of years maybe. At age, I think 17 or 18, when I was getting close to having my final checkup with a pediatric cardiologist, one of my sisters, who historically is not very emotional, she became very worried about me. I don't remember if she had a bad dream or anything like that, but as an older sister, that was very touching, and it really just made me kind of think a lot more about my own personal health. And we were all fairly active. We had a small hobby farm sort of. We had goats and chickens and sheep. We had horses at one point. We had a cow at one point. We would bottle feed goats. We'd build barns and we'd do all sorts of things like that. So we were all very active, but I had decided to start running. So I would wake up early in the morning and go for a short run. I think my My form was terrible. My breathing was not optimal for running or anything like that. I didn't really know what I was doing. I just really enjoyed running, and it was just a really fun form of exercise. So I began doing that and just taking my health more seriously, eating cleaner. So then I went for my checkup, and of course my sister was like praying the whole time that I would be healed and everything, and I was praying similar prayers. But so we went in for my checkup, and my cardiologist told us that my heart valve looked different. So instead of it being a bicuspid, it was a trileaflet, but there was a small leak. I don't remember exactly what was said, or if she mostly talked to my mom, or what happened, but basically I left the office thinking I'm cured. Like it's a miracle, I'm healed. I won't ever have to deal with this ever again. So that's kind of what we all thought. I cringe thinking about it at this point, but yeah, that's what happened. Thinking I was cured, I basically just ignored my heart condition again for years. When I was about 22, I was pregnant with my first child, and everything changed. I hadn't had insurance or checkups in years. Do not recommend. The midwife that I was seeing, she sent me for an echo once she heard about my heart condition and everything. I went in alone, expecting everything to be like totally fine. My husband at the time worked away, so he wasn't there, and I hadn't thought to bring my mom or anything. But so the doctor's first words to me were, well, the good news is you don't have to terminate your pregnancy. Excuse me? Maybe there's someone out there who would be okay with being told this, but here I am thinking like I'm okay. I just was not ready for that response. I was around 20 weeks or so, I believe, and it just felt like a slap in the face. It was very abrasive. His bedside manner was non-existent. He was not a very great doctor. I did not appreciate the way he talked to me, and he really scared me. He said that I had developed aortic stenosis. So aortic stenosis is a condition where the aortic valve, which regulates blood flow from the heart to the body, narrows, making it harder for the heart to pump blood. This narrowing or stenosis can lead to a variety of symptoms, including shortness of breath, chest pain, and fainting. This is what I was diagnosed with. He said that it was in the severe category, which would mean that right after delivery, if I made it through delivery, I would need to have open heart surgery, like immediately following delivery of my child. So that was quite shocking news. I sat in my car crying. I was completely overwhelmed and confused. This was my first real experience with medical trauma and the psychological impact of conflicting information from doctors. I couldn't process going from being healed to suddenly being told that I might not survive childbirth. It was very anxiety inducing, and the anxiety was crushing. At that point, I didn't really have a word for anxiety. I was not super in touch with my emotions. I wasn't really taught how to regulate emotions very well. And so I didn't really have the vocabulary I have now in order to process things. I just remember crying, driving to my mom's house, calling my husband at the time, and just feeling a profound sense of fear and confusion. What did this even mean for my future, for my ability to be a mother? The uncertainty was almost worse than a definitive bad diagnosis. The doctor I had seen was a fill-in for one that I was supposed to see. He happened to be on vacation, so I had seen this other guy. When he was back, I went in for a second opinion, and that doctor confirmed aortic stenosis, but he said that it didn't look severe to him. He was shocked at how I had been treated and really kind of apologetic about it all. He said, it is something that is worrying, but he thought that I would make it through delivery just fine. He didn't think that it was progressed to the point where it would really cause me too many issues. I just needed to be monitored. So of course I couldn't go to a midwife. I had to go to a high-risk OB and birth in a hospital. So all my plans of having a midwifery center birth went out the window. But the damage to my mental state was done. I had to learn to navigate conflicting medical opinions while pregnant, which taught me the importance of getting second opinions and advocating for clear communication. You really have to advocate for yourself, unfortunately, so don't be afraid to speak up, especially if it's like one of your first times like dealing with medical people. Thankfully, my son's birth went just fine. I definitely had some like birth trauma afterwards because of the way things had been handled. It was not a very good hospital experience, unfortunately. I ended up not liking my doctor very much at all. Postpartum ended up having heart palpitation episodes where I still don't know what these were, but I would just get a pounding heartbeat for long stretches of time. Typically towards the end of the night. But I actually called my OB and she kind of blew me off and was just like, I don't know what it is. Maybe just, you know, you might be anemic, so go ahead and take some iron supplements. And that was pretty much it. I wish I had actually reached out to the cardiologist and asked him if that was anything concerning and like gotten checked out and everything. Unfortunately, a lot of people just did not seem to care. This was the first time I really started to feel health anxiety. I was holding my newborn at night. He just needed to be attached the whole time. He needed to be held. He needed to be nursed in order to fall asleep and even stay asleep sometimes. And that first week was very rough. The first whole month was very rough. Postpartum for me has always been really emotionally tough. You're dealing with sleep deprivation, the influx of different hormones, and just figuring out breastfeeding and like all of those things can be very challenging. So there's something I wanted to touch on. I was editing this video and I forgot that I didn't include this, but postpartum is not all doom and gloom. I know I got a little focused on all of the negative side of some of these like issues and everything. I just wanted to say that while postpartum can be challenging, it's not all super like dark or anything. There were moments where it was just super magical and you have this new little life that you brought into the world. You get to participate in creation and it is a magical feeling. And having this little baby that you just fall in love with, and you just know that no matter what, you're going to love this little human as they grow and as they become adults and as they enter the world and do all of the things they're going to do. And it is a really, really wonderful experience to be a parent. I feel like the positive aspects were very emphasized as I was growing up. And in the circles I've been in, it's very glamorized. It's very... Everybody puts a positive spin on everything, which is not a bad thing always, right? But I just wasn't prepared, it felt like, for the darker part of these things. And everyone's experience is different as well. So I just wanted to touch on that. There's definitely aspects of postpartum that I absolutely loved, and like sitting there with your newborn and just soaking it in and just enjoying that time together it's really, really wonderful. And I can't emphasize that enough. But yeah, I just wanted to share like my reality, and like I had those two things happening at once, I guess. I mean, you're growing. You're getting used to this new normal and, you know, navigating this new thing of while you're healing, and you've got the hormonal fluctuations and all of those things going on. And you are now responsible for this little tiny life, and you've never done this before. So it can be very challenging in a lot of ways. But with growth, there's often a little discomfort, and it should be little. It shouldn't be overwhelming. And if you are feeling overwhelmed, do not hesitate to reach out and try to get some support, even if it's just from someone in your community who can come and do the dishes for you or make a meal or whatever, things like that. Just if you really need to, reach out to a therapist, find someone to help support your mental health while you are also caring for this child, because you cannot care properly for someone if you do not care for yourself first. So make sure that you are caring for yourself. On top of this health anxiety that I just didn't understand, I was holding my newborn at night, trying to nurse him, and then having these episodes thinking I was going to die all alone and leave my child without apparent. My husband would just kind of shrug and be like, I can't do anything about it, so he would go to bed. So I was literally just left by myself dealing with this, and it was very, very tough. Thankfully, the palpitations would go away, and eventually I wouldn't have them anymore. I wish at this point I had reached out either to the cardiologist or just had gone to therapy. I wish that I had that kind of foresight, because I just dealt with this like medical trauma and stuff and just kind of pushed it aside. And I feel like that came out in other ways. I had a lot of unresolved trauma that I just did not understand. My saving grace was my beautiful baby boy. He was just, and is just amazing. So focusing on him is what really got me through all of it. And he's 10 now. That is insane. But yeah, he is such an amazing young man. I'm very, very thankful for all of my kids. When my son was about a year old, I think a little older than that, I went back to the cardiologist and got another checkup. I didn't have an echo, but I just, he listened to everything, and we talked. I was curious about whether or not I would be able to have a midwifery clinic birth with my second child, and he wanted to wait and see until I was pregnant and at the same gestation to do another ultrasound to make sure things were the same and hadn't progressed, because things would look differently when I was not pregnant versus when I was pregnant. If that was the baseline we already had, he wanted to kind of check that as well. It was hopeful, but we just didn't know definitively. But I knew I wanted to have more kids. So I ended up, unfortunately, having a miscarriage, and then a few months later ended up divorced. So that all ended up changing a lot of aspects of my life, of course. So then I ended up not being able to afford healthcare again for years. So I didn't get any more checkups. Again, I do not recommend this. This was not great. I was single for 2 years, and then I met and fell in love with and got married to my current husband. He is the most amazing human that I've ever known. It's wonderful when you find your best friend and spouse in one person. I ended up getting pregnant fairly quickly after we got married, and chose a midwifery team to have a home birth with. And this was partly about reclaiming some control and having a positive medical experience after such a traumatic medical experience. Looking back, I do wish they had investigated my heart condition more thoroughly, because I explained what happened and then the follow-up I had had previously, and they were just like, oh, okay, sounds good. And they didn't really take a lot of time to kind of investigate further, which I have conflicting emotions over, because I feel like that was not the best decision medically, but I also am very thankful for that care team and the peaceful home birth that I got to have. So yeah, again, I don't really recommend this. This is just what ended up happening in my life. So that whole experience was great. I'm very thankful that I got to have my home birth. The only thing that was really concerning was that I did pass out after birth. That was terrifying, and of course it triggered all my health anxiety again. But I was okay, everything turned out fine. Marriage itself actually kind of ended up being a trigger for me, and I did not expect that to happen. So our first whole year was up and down. It was simultaneously one of the most amazing years, and there was a lot of struggles as well. I think it's like that for most people when you go from not living together to living together and like figuring everything out. The first year can be a struggle for a lot of couples, but I feel like the living together part wasn't that hard, because it felt very seamless. The part that was hard was the unresolved trauma that I hadn't even addressed at all in my life. So that ended up interfering a lot just with daily life, and I would get triggered, and I didn't know what was happening to me. I just felt like I was going crazy. That, I know that is like not a great thing to say, but I really did feel that way. I felt like I was losing my mind. I didn't know how to adjust to anything. So we ended up going to our pastor and having a conversation with him. We told him the struggles we were having, and he was very patient with us. He listened and everything, and he just told me, he was like, it sounds to me like you are dealing with trauma, and I am not qualified enough to like address this for you. So he recommended that I reach out to a couple different ladies in the church who knew of therapists and who had gone to different therapists before. I did, and I found one and started seeing her, and it's been an amazing experience. And thankfully I only had to try one therapist. That is apparently very unique because a lot of people have to like shop around to find the right one. So don't be afraid to search for somebody that you're gonna really like get along well with, because that is very important. So I started therapy. I was diagnosed with anxiety and PTSD, which helped me understand that my health anxiety wasn't just about my heart. It was connected to relational trauma, religious trauma, sexual trauma, and the way the medical experiences had been handled throughout my life. It was a lot to process and go through, and it wasn't all at once. It was kind of like this gradual thing, and I am still regularly seeing my therapist and just unlearning things and relearning things and just processing a lot of stuff. So, jumping ahead, during my third pregnancy, a lot of my health stuff with my heart coincides with pregnancy. But so during my third pregnancy in 2022, my anxiety got significantly worse. I was having not just general anxiety, but specifically health anxiety, because I was having these heart palpitations a lot more noticeably than ever before. I was just hyper aware to my body is what it felt like. And it would just kind of come out of nowhere, and it would just leave me feeling very uneasy. It's exhausting to live in a body that you like can't trust, it feels like. So I was working with my therapist, and it taught me that having a chronic condition affects your mental health in ways that people just don't typically talk about. So with this pregnancy, I had also decided to have another home birth. This specifically was a home birth midwife that I was working with. She would come to our house for checkups, which was amazing. So since I was having these heart palpitations, I shared my concerns with my midwife, and I was in the last month of pregnancy, and she was like, gently urging me to go and get my heart checked out. I could tell that she was not comfortable with like doing this without having my heart looked at and having a cardiologist say that it was okay. I decided to listen to my intuition, her intuition, and just go and get seen. That appointment was very frustrating. I walked in with my husband, and they immediately hooked me up to an EKG machine without any explanation. And then they scheduled an echo without even talking to me about it. We were sitting in the office after talking to the doctor. He had looked over my file and told me that I had aortic stenosis and it was severe and like blah, 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 all the same sorts of things I had been told before, but we didn't really have a clear plan. I didn't really know exactly what was happening. He wanted me to have an echo, and then we'll go from there. And so I still kind of didn't have any answers. And then he left the room, and then we were just sitting there wondering if we're done or if he's coming back or if anyone's coming back. And then I got an email on my phone that my echo had been scheduled, and it was scheduled literally for the day before my due date. So that was very frustrating because no one had talked to me about when my due date was and, you know, all of those things. And so it was very aggravating. I had to work out with the scheduling desk like something sooner because I couldn't just wait till the last minute like that and then go to the hospital. Ended up getting an ultrasound maybe like a week later or something. Then I was able to do a telehealth appointment with that doctor, and he told me that the stenosis had progressed a little bit, not a lot, but it had changed some. And he said that since I had tolerated birth well the previous 2 times and I didn't need any interventions, that more than likely I would be fine birthing in a midwifery clinic that was right near the hospital. So I was like, okay, that's great, because it's not completely, you know, in a hospital, but it's still more safe and all of that. So my midwife did not have hospital privileges, but she worked with midwives who do. And so she would be able to come along as like an unofficial birth assistant, you know. So she gave them my file, and they looked it over, and then they were like, we're going to have this OB that we know check it out and make sure that everything's fine. She took a look at my file and was like, you need to have her come see me. So I was very concerned at that point because they had explained that this was not an alarmist. This OB was very pro birth however you want, if in the hospital, outside the hospital, just as long as you're safe. So I went in knowing that she should be a lot safer to talk to about this kind of thing. And thankfully, my midwife was able to come with us. She came with us to that appointment. And we had a really good conversation with the doctor. She was amazing. I still love her. She was the first person to actually explain what was happening to me in terms that I understood. I really appreciated that so much because there was a piece to this puzzle that I had not been told about. And if they had told me about it, it hadn't been told to me in a way that I understood what they were saying. So she explained the whole problem with my heart, right? So I had been born with a functional bicuspid heart valve. I was susceptible to getting what is called aortic stenosis. And the aortic stenosis caused a ascending aortic aneurysm. So that is when the aorta starts to bulge out and there's like a thinning in the wall and stuff. And the problem with this, obviously, especially in a situation like pregnancy where your blood volume can double and you're going to be doing an intense work of birthing a baby. The problem with this is when you bear down, you can rupture a aneurysm. Mine wasn't very big. It was still fairly small, but it was big enough that it was concerning since I was about to give birth. This was a completely terrifying realization that I had this other piece that I had not been told about this whole time. It really felt like a betrayal by the medical system. So she explained all the risks, honestly but compassionately. And she also shared that, unfortunately, they had lost a mother with this same condition, like the month before this. So that terrified me, but also validated that my fear wasn't irrational. And honestly, I am thankful that I eventually listened to my body's intuition and to my midwife's intuition and went and got checked out, because who knows what could have happened. Maybe things would have been fine, but I probably wouldn't have known that this condition had gotten so bad at this point, because I didn't really have any plans to go get checked. I think mostly I was in denial that anything was really bad, and I just wanted to put off dealing with surgery. So I was very thankful for this doctor explaining everything so that I could understand it. So I was also just scared that I wouldn't survive. I went sock shopping for my kids, and I had this conflict, and I was just like, I have to get them the best socks ever because this might be the last time I ever get to buy them socks. And I was very emotional. It was a very emotional time, and I'm just very thankful that obviously I made it. Everything was good. My baby was healthy. I was healthy. Like, everything was fine. Thankfully, the birth went, especially for a high-risk birth, it went amazing. My whole team was incredible. They had heard that my last hospital experience was less than ideal. And because of that, they went above and beyond to make this birth an amazing experience. So despite my being high risk, everything really everyone was so sweet and so caring. And they just did an amazing job at making me feel like I was cared for and heard, and I had plenty of room to ask questions and talk through things. So I did have to be induced, which was so intense. I had never been induced before. My first two births had been completely unmedicated vaginal deliveries. So this was completely new. I wasn't able to get an epidural because the anesthesiologist, I think I said that right, was afraid that my heart rate would get too low, I believe, is what the fear was. No epidural. Pitocin contractions are no joke. They hit different. So for me, regular contractions without any Pitocin or anything feel a little more like this kind of a dull squeezing feeling. And Pitocin contractions feel sharper. They feel like that squeezing sensation, but with claws, like a cat claw. That's the best way I feel like I can describe it. It was very, very intense. So I was monitored extensively. I was hooked up to so many different machines. One of the nurses was so sweet because there was this one monitor thing that I kept having to like carry with me anytime I went to the bathroom or whatever. And she emptied out a fanny pack that she had, and she helped me put all of this stuff in it so that I could just have it attached and I didn't have to like carry it. She was so sweet, and I made sure she got her bag back because we didn't see her again, unfortunately, until she came back on shift like after we left. Yeah, she was so sweet. I loved the nurses there, but I was just hooked up to so many different things, monitoring everything. At one point, my heart rate got too high, and so the team that was monitoring my heart rate had called, and I don't think I was supposed to overhear, but I heard one of the nurses telling the doctor, and they were all trying to get me to calm down, and I heard them say that my heart rate was getting too high, that I needed to try to kind of calm myself. And I realized I had been gripping the pillow that I was like leaning against, because I was kind of like on all fours, like leaning up on the hospital bed. They had it tilted up for me. And so I realized I was clenching a lot, like during contractions, and it was really hard to like stay on top of them and like ride the waves and all the different things that I had always done to get through labor. It was just a lot more challenging. So I realized that by doing that, I was just kind of clenching and not allowing everything to kind of flow. So I relaxed my hands and just breathed deeply and got everything calmed down. It was probably the hardest thing that I have done or ever will do. It was so intense, but it also taught me that I am very strong, that my mind is an incredible tool for getting through hard things. So that is something that has given me a lot of comfort, just knowing that. And I know that that will come in handy when I'm healing from open heart surgery. So this birth was actually where I met my current cardiologist. So he was so nice and thoughtful the couple times we saw each other, like right before birth and then right after birth. I definitely had wanted to follow up with him instead of a different doctor. And I'm very thankful for him and the superb care that he has given me for the last few years. Obviously, the birth was successful. I'm still alive. My heart showed no changes afterwards. They had given me an echo right after. Everything was fine. Postpartum, though, was brutal on my mental health. So when you have a medical condition and you're in the hospital and you're being monitored for everything, there's people worrying about all of that for you. So it's a lot easier to just kind of relax and not worry about it too much. But when you go home, suddenly you are the one responsible for monitoring everything and taking care of tracking your symptoms and making sure that if there's anything wrong, you call someone or whatever. For someone with health anxiety, this is terrifying. I was not prepared for that. So every little sensation became a potential emergency in my brain. Every heart palpitation sent me into panic mode. I was hyper vigilant about my body in a way that was exhausting and unsustainable. I was still working with my therapist, thankfully, which probably saved me, but I was struggling really hard. The isolation was real too. Shane was the only one who really understood what I was going through mentally. I feel like part of that is my own fault, because I do have a difficult time opening up with everyone, especially back then. I feel like I'm a lot more open now to a lot more friends, because I don't want him to be the only one handling that like mental and emotional weight. So I know that it is healthier for me to have a few different people in my life that are able to listen to me vent and talk about the things that I am struggling with. That has really helped. But at that point, I hadn't opened up to too many people yet about everything. So he really was the one person I could completely rely on with everything and trust with everything. And so that was very helpful to me. And I am so, so thankful that I have him. He's also the most amazing birth partner. Seriously, like everybody in the hospital was like, you should teach classes. So jumping ahead, in 2023, so a few months after I had my baby, I went and I got another echo, and then the doctor wanted me to go have an MRI because I had never had one, and he wanted to get a good baseline after pregnancy and all of that. So I had an MRI for the first time, and it revealed the true nature of my valve, which is a tri-leaflet that's fused together and functions like a bicuspid. So my stenosis was moderate, approaching severe. So it wasn't severe like we thought it was with the echo and everything in pregnancy. It just had distorted things and made it look a little worse than it was. So that was hopeful. I was able to get back to exercise. I started running again. The problem with running was that I did experience heart palpitations and stuff while running occasionally, and that would set off my anxiety again. So the biggest issue for me was that running was hard because of my mental health, and running helps my mental health. So it was this weird vicious cycle that I couldn't figure out. So I began walking more, and that seemed to help because it wasn't as high impact. It was a lot easier to sustain, and that just ended up working out really great. So I did daily walks for a long time. And I also switched to a mostly plant-based diet. So we, for the most part, will eat sort of like a whole foods plant-based / Mediterranean style diet. So we try to limit processed foods. We avoid dairy. We don't eat meat other than seafood. So I lost a bunch of weight and was just feeling really good until I wasn't. Unfortunately, the last year or so, my health has started to decline a bit. I would begin to have a lot more heart palpitations with exercise. Like when I was running, I wouldn't even be running super intense, but just I would get to that runner's high kind of feeling, which is the best part of running. And then I would just begin to have heart palpitations off and on, and they would continue for the rest of the day. So unfortunately, that was just really a struggle because I love running, and it just took away something that I really enjoyed, and that was really hard. My health anxiety reached a point where I couldn't really enjoy activities very well with my kids. I couldn't be present as much as I wanted to because I felt like I was just constantly monitoring my body for signs of danger. This is when my therapist and I started discussing medication options, and was thinking about maybe trying to go and get a prescription for something, but I also have a lot of anxiety over medication and everything, so that is also another piece that I'm working through right now. But I decided to try some natural supplements at first, and they were very helpful. They've kind of taken the edge off of a lot of the bigger anxiety symptoms that I was experiencing, and made it a little easier to just kind of exist, which has been amazing. Then that started not being quite enough. So I had another echo, and then ended up having echoes every 6 months. And in February, the echo I had, I looked at the report before I had talked to my doctor, and I could tell that things had progressed because just looking at the numbers, I was like, oh no, I think that my heart condition is now severe. And we had our follow-up with him, and he confirmed that yes, it was severe, and he wanted to do yet another ultrasound in order to get a really good picture of everything before surgery. He didn't know yet when surgery should be, but just thought that surgery was probably either this year or next year. So I had my MRI, had a bunch of freakouts over potentially having surgery and stuff. He prescribed me a beta blocker to help with the heart palpitations since they were making me very nervous. And I took them, but I only ended up taking 2 doses because they dropped my blood pressure really low, which again made me very, very anxious. Thankfully, I was fine after I stopped taking them. So I had my MRI, and then my doctor called and told me that yes, I have severe aortic stenosis, and he recommends that I see someone immediately to talk about surgery options because he doesn't want to leave it very long, because if you leave it too long, it can cause an enlargement of the heart and a bunch of long-term health issues that you cannot reverse even with surgery. So they want to get it done faster, So he referred me to a surgeon, told me that he is, a really great surgeon, that he works with younger patients, that everything should be just fine. Very, very reassuring and everything. So I was waiting to get a call from their office for a while. Finally got a call, got everything scheduled, and then I was just waiting for that appointment to find out when I was having surgery and all of that, and kind of trying to make plans with family and everything, because this surgery is going to be a very long recovery process, and so I'm definitely going to need a lot of help with the kids and everything. During this time, somewhere in here, I began having these nightly episodes. I've had them off and on ever since I've had my third child. It'll come on sometimes like a wave of like weird sensation. Like, I don't know if it's adrenaline or something. And then my heart will just pound and it'll be hard to sleep. I'll just get anxious thoughts. And I think for a long time, I thought it was just an anxiety attack. And I think there's two pieces of it. I think it is anxiety related, but I think it's being exacerbated by my aortic stenosis symptoms. So I shared this with my cardiologist through the patient portal thing, and then he was like, okay, I think this might be cardiac related, so we're going to go ahead and prescribe you a different beta blocker, a very low dose. This is not typically given to drop blood pressure, so it shouldn't interfere with my blood pressure. He had prescribed me that, but I hadn't got the prescription yet. And a couple days later, I ended up with, I think, what was a panic attack. I had really intense symptoms that I could not get rid of. So I was totally convinced that I was going into heart failure. I couldn't calm down. Every coping strategy that I knew and I was trying to use, and it just was not working. So I realized that my health anxiety isn't just, being anxious about health. It's very real, very physical experience that can be just as debilitating as the condition that you're worried about. So I decided to go into urgent care because I was out of breath. My chest hurt. I had these weird sensations everywhere that I couldn't explain. And I just knew that I wouldn't be able to sleep if I didn't have a doctor tell me that I was going to be okay. So I went to urgent care first. The doctor was very kind, told me that I needed to go to the ER because she did not have the necessary equipment to really give me a thorough exam given my specific condition. And she wanted to be on the safe side. So she's like, even if it is just anxiety, like, you need to have these answers so that you know. And she didn't want me to go back home and have some sort of event happen while I'm with my kids. So yeah, she was very reassuring, very kind. We ended up going to the ER. So I got an EKG, a CT scan, and blood work done. Everything checked out fine medically. But going reinforced something important, that I'm not crazy or overreacting. When you have a serious heart condition, some level of anxiety is completely rational. So everyone at the ER reassured me that I made the right call. If something bad had happened, I needed to be in the hospital. So it was really the best place for me to go to make sure that I was okay. And yeah, that validation meant everything to my mental health. Meeting with the surgeon was emotionally complex. When he walked in, we were very I was busy filling out paperwork still. My husband was in a weird headspace because it's a lot to wrap your brain around, someone you love having to have this major operation. And so he was just like, you don't look very happy to see me. And I was just like, sorry. He's like, it's okay. Most people, aren't very excited to see me. And I was just like, that must really suck. That sort of profession, where you're just in a way, people are happy that you're there, that can save them. And then it's just challenging. So that, yeah, but thankfully, he was great. He broke the ice really well. And we all ended up talking, and he let us see the mechanical valves that they had and the synthetic graft that he'll be using. So this whole operation, what is going to happen is they're going to replace my aortic valve with a mechanical heart valve. I'll need to be on blood thinners, but he reassured me that once you get through the figuring out your INR levels and everything, that at that point it just becomes taking a pill and everything's normal. So really hoping that's the case. I hope that I don't end up needing to take iron supplements or something because of my period and all of those things. But anyway, so I'm going to have a mechanical heart valve, and then part of the aorta is also going to be replaced with a synthetic graft. And so we got to see these things, and it was really, really interesting. And he did not rush us through anything, took his time. We just talked through the whole procedure. He told me exactly what he's going to do. It was very interesting. And he also ran a calculation of my risks, and my risk is extremely low that anything bad is going to happen. So that was very reassuring. I left being very reassured. My husband left feeling a little more anxious. Because it just made it all so real for him. There is a grief process to all of this in accepting that my body needs mechanical parts to function properly. I'm 33, so I'm not even that old, but I'm facing the reality that I'll never have all original parts again. That's a mental adjustment that goes beyond just the physical healing. But on the other hand, it is kind of cool that I will be technically a cyborg. So, just saying. I guess that's a benefit. So my surgery is scheduled for June 5th. It's just a few weeks away, so that's like crazy. So I'm a planner, and having that date has really helped me relax about some things and just kind of know what to expect and plan for. So I'm very thankful to actually have a date now and like be able to plan things. My in-laws are going to come and stay with us for a month to help out with the kids, and we have people from church that are setting up a meal train for us, so they'll be delivering meals and stuff so we don't have to worry about food for a little bit. And it's very, very reassuring to have so many friends and family just reach out and surround us at this time, and that has been so nice. But what I want people to understand is that living with a heart condition or any chronic condition affects your mental health in profound ways. So it changes how you see your future, how you parent, how you make decisions. The medical community is getting better at addressing this, but we still have a long way to go. Therapy has been absolutely essential. Having tools to manage health anxiety, process medical trauma, and distinguish between rational concern and anxiety spirals has been life-saving. If you're dealing with something similar, please don't try to tough it out. Please reach out to someone and get support. So I'm documenting this journey partly for my own processing, but also because there aren't a lot of resources for women going through this sort of thing. Aortic stenosis is typically a thing that men deal with. So I haven't found a ton of resources about women going through this operation, hoping that by being open with my journey, I can help some other women who are going through this process as well. If you're going through something similar, please comment. I would love to connect with you. We don't have to go through this alone, and we shouldn't have to. Any well wishes or prayers are welcome. I've also set up a GoFundMe because that is another part of this whole thing, and if you would like to help out with the financial burden of this surgery, then that is available to you, and I really appreciate it if you would at least just share this video, like and comment. All of those things help me out a lot. Thank you so much for being here through this vulnerable sharing. Taking care of our mental health is just as important as taking care of our physical health. So I really hope that this video has helped people a little bit, at least to understand like this whole process. I hope that you have a lovely day, and as always, stay lovely.